Is there any risk or side effects for dental veneers? What's the problem that we can have if we put the veneers? To be honest, I want to explain something that's very important about the cosmetic dentistry field in the last 10 years. With the emergence of the veneers and ceramic veneers and IMAX veneers, it became a little bit commercial in some dental clinics. Some dental clinics offer their patients a lot of fake information about the lifetime and about the cost of the veneers. To be honest, you have to understand that when we do the regular traditional preparation veneers, we have to remove a thin layer from your tooth, which is almost 0.5 to 1 millimeter. This layer is usually the same thickness of your enamel layer. And you have to understand that the enamel layer was created to protect your tooth from the water inside the mouth and from the different acids and foods that we eat. By removing this enamel layer or thin part of it, your teeth become weak, sensitive, and easy to decay. And due to the commercial part that came in the field of dentistry in the last 10 years, a lot of dentists hide this information from their clients. But you have to understand that by removing this thin layer of your tooth now is sensitive and weak. And by time your tooth will start to lose its color, because the enamel layer is the layer that's responsible for the shiny and smooth surface that you have for your tooth. Also, your tooth will have caries very easy. Sometimes the pulp become infected if the dentist is not professional and he do a lot of teeth shaving or teeth preparation, and they will need intervention to remove the pulp. By removing also the pulp of your tooth now become dead. A dead tooth is usually very weak and it starts to decay easily, and its color starts to turn black. A lot of young girls and young boys started to lose their natural teeth by having this kind of cosmetic procedures and by shaving their natural teeth. Some of them already lost or extracted many teeth because of this teeth reduction and shaving. So if your teeth are sound and you don't have any problems, we don't recommend shaving at all of your natural sound teeth, because crowns and veneers, when they were invented for the treatment of problems in the teeth, not for cosmetic procedures. Also, we have to understand that the prices of the dental veneers or dental crowns is not that expensive. And by paying a lot of money for this kind of treatments will not give you the best result. Some dentists, they offer $2,000 and $3,000 for one tooth, one veneer, and this is a lot of money. To be honest, at the end we use almost material from the same company. We have a lot of companies in dentistry. These companies is working all over the world and they use the same material almost. So by paying $2,000 or $3,000 for one tooth will not give you a good result. As long as you started to shave your teeth will become weak. However, if you put the most expensive material, it will not make your teeth strong again. Also, a lot of dentists start to give some fake information about the lifetime of veneers. They say that it can last forever, and this is not true. Usually veneers have a lifetime that lasts from 5 to 7 years. In some cases it was reported that they last up to 10 years. And this depends on the care and depends on how checkups you make with your dentist. And it also depends on the materials that we use and the kind of glue that we use. To be honest, also after this time you have to repeat all the procedure and you might pay the full amount of money again, and at the same time you cannot live again with your natural teeth because you already lost the part from your tooth that protected. Also, this fake information make people think that okay, it will last forever, it will last 20 years, so we can do it. No, it will never last forever, and it can never last for 20 years. It's very hard to do like this. And some other dentists recommend dental crowns as a type of cosmetic treatment, and this is very, very dangerous, because if your teeth is sound and you start to shave them all and put a dental caps or dental crowns over your teeth, it's a big problem, because usually when we do a dental crown, the pulp is inflamed and we need to remove it. So imagine that you remove the pulp for 20 teeth, they are all dead, and then you cover them all with crowns. And this is very risky because you might have some infection in the bone, you might have some problems. And all your life you have to live with the dentist in his clinic, changing crowns, replacing crowns, doing dental treatments. So also you have to understand that this is very dangerous. So as far as your teeth is sound, natural, we don't recommend any kind of shaving of the natural teeth. Also, we have to explain to the people that the commercial part in dentistry now, with the beautiful pictures that we take, with a lot of modern cameras and a lot of modern flashlights, they make the crowns and veneer look more beautiful than they look in the natural life. Because with this kind of cameras and the flashlight and some editing with the Photoshop, you will see very beautiful pictures on the social media for teeth. But this is done, as we said, after editing and after using very professional cameras. Also, you have to understand that the gap in prices for the dental treatment doesn't come from the material or the dentist. It comes only from every dentist in his practice and his point of view. Also, I would like to explain to people something important, that now we don't need to shave teeth at all to put veneers. With the no prep new technology veneers, you can even see the veneers before you do them, and you don't need to shave any part of your tooth. For sure, it is not a technology that's old, it's a very recent technology, but it will give you a very good result without the need to shave any part of your teeth. You can have different shades of whites, you can choose the shape you want, and you can even see how the veneers will look before you pay the money or before you do them. And also, what is very good about this technology, that at any time you can remove the veneers and you can stay back with your natural teeth without the need for any other intervention or treatment. The care for this kind of veneers is very simple, just brushing and flossing and a checkup every 6 months. The lifetime usually lasts from 4 to 5 years. In some cases, it reported up to 7 years or 8 years. And at the same time, to be honest, we have to understand that whatever you do in your mouth has a lifetime. There is nothing permanent. Even your natural teeth, because of the bad habits, will decay, and you sometimes need to make filling or even do some treatment. So no dentist can do for you something that will last permanent. Everything has a lifetime. It's very important also that you understand real information about cosmetic dentistry before you start to shave or remove any part of your tooth, because what you will lose from your tooth, nobody can make it again. This was created in a very complex way. Usually enamel layers that you have in your mouth need 1 to 1.5 years to be created by the cells of your body. And it's made from crystals with a very complicated structure that no laboratory or no machine can do. So my advice for everyone, that you have to understand the reality in this field now, and you have to understand that there is a commercial part that started to show in our career. So you have to be careful, and you have to understand that your natural tooth, as far as they are strong, they are healthy, no need for any shaving. You can just go for the lenses without any teeth shaving, or you can go for any kind of polishing.